When you arrive at an emergency room with a suspected heart attack, one of the first questions doctors ask themselves is this actually a heart attack? The answer often comes from a single protein in your blood. Its name? Troponin. In this video, I'll explain what troponin is, why it matters so much to emergency doctors, and why, if you have typical symptoms, you should never wait for a blood test result before calling emergency services. If this interests you, please consider liking this video and subscribing to Lebenspulse for more evidence-based health content. My name is Dr. Adrian. Troponin is a protein that normally sits deep inside your heart muscle cells, where it helps control muscle contraction. In a healthy state, virtually no troponin enters the bloodstream. But when heart muscle tissue is damaged, as in a heart attack, when a coronary artery is blocked and part of the heart no longer gets enough oxygen, cells die and troponin leaks into the blood. That's exactly what makes troponin the most reliable marker modern emergency medicine has for confirming acute heart damage. Here's the point that's often misunderstood. Troponin doesn't rise before a heart attack to warn you. It rises only after the damage has already begun. It typically becomes detectable in the blood about 3 to 6 hours after symptoms start, peaking at 12 to 24 hours. So it isn't an early warning system that alerts you in advance. It's a confirmation tool used in the hospital after you already have symptoms and have already called for help. Why am I telling you this? Because there's a genuinely dangerous misconception out there. The idea that you could somehow check in advance whether it's really a heart attack and only call emergency services once you're sure. That exact hesitation, according to data from the German Heart Foundation, is one of the most common preventable reasons people die from a heart attack or suffer lasting damage. In the next part, I'll explain exactly how emergency doctors actually use troponin, and more importantly, which symptoms you need to recognize yourself, because those, not a blood test, should be what triggers you to act. This video is for general informational purposes only and does not replace individual medical advice or emergency care. If you suspect a heart attack, always call emergency services immediately. How do emergency doctors actually use troponin? When a patient arrives at the ER with chest pain, blood is typically drawn right away, and again 1 to 3 hours later, to see whether the troponin level is rising or falling. That trend, not a single value, is what matters. A clear rise points to acute heart damage. A level that stays low across several hours makes a heart attack unlikely. But this is exactly where a well-known limitation of the test comes in. In the first 0 to 6 hours after symptoms start, troponin can still look normal even if a heart attack is actually underway. That's why doctors never rely on a single early troponin reading alone. They always combine it with an ECG, and above all, with your symptoms and medical history. This is exactly why this test is a clinical tool, not a test you can run on yourself at home. So what should you actually recognize before anyone even gets to the ER? The German Heart Foundation describes the typical warning sign as sudden, severe, burning or pressing chest pain, often behind the breastbone, lasting longer than 5 minutes and not improving with rest. This pain can radiate into the left arm, both arms, the jaw, the back between the shoulder blades, or the upper abdomen. Shortness of breath, cold sweat, nausea, and a feeling of extreme fear or dread often accompany it. Important. Heart attacks in women often present less typically. Instead of classic chest pain, symptoms can be dominated by nausea, vomiting, shortness of breath, or upper abdominal pain, symptoms that are easily mistaken for a stomach issue. That's another reason to call emergency services when in doubt, rather than wait to be sure. And that brings us to the key point. You don't need to be certain it's a heart attack to call emergency services. The job of determining that, using tools like troponin, among others, belongs to medical professionals, not to you. Your only job in that moment is to recognize the symptoms and act immediately. In the final part, I'll walk you through exactly what to do, step by step, if you notice these symptoms in yourself or someone else. So what should you actually do if these symptoms appear? First, don't hesitate. Call the Europe-wide emergency number 112 immediately, even if you're unsure, even at night, even on a weekend. Tell the dispatcher clearly that you suspect a heart attack. Second, never try to drive yourself to the hospital or have someone else drive you. An ambulance is usually faster, can begin treatment on the way, and carries a defibrillator in case of cardiac arrest. Third, sit the person down with their upper body slightly elevated and loosen any tight clothing. If the person becomes unconscious and isn't breathing normally, begin chest compressions immediately and stay on the phone with the dispatcher. What you should take away from this video. Troponin is a fascinating and genuinely important tool in modern emergency medicine, but it's a tool for the hospital, not for deciding whether to call emergency services. That decision is made based on your symptoms, and when in doubt, it's always better to call too early than too late. If this video was helpful, please consider liking it, sharing it with people in your life who should know this, and subscribing to Lebenspulse for more heart health content. Let us know in the comments which city you're watching from. We always love hearing from the Lebenspulse community.